This is the Expect Miracles podcast. Enjoy the show. Welcome, everyone, to another episode of the Expect Miracles podcast. If you are enjoying the show, subscribe for weekly podcast episodes, and don't forget to leave us a review to help spread the Expect Miracles message. Today on the podcast, we have Dr. Skylar Pond. Dr. Pond is a chiropractor and sports medicine physician at his practice in Seattle, Washington, called Sports Medicine Northwest. Dr. Schuyler is the man, and it was a pleasure sitting down with him and having him share his story with me. I was very fascinated with his own healing journey when he told me at the age of 23, he was told he needed to stop playing rugby and have surgery on his torn labrum in his shoulder. Now, Dr. Pond had a professional rugby dreams, and so you can imagine how devastating this was to hear at such a young age. But Dr. Pond is a determined individual who does not take no for an answer. He took it upon himself to create his own shoulder rehab program, and he was able to get himself back into playing rugby, which then led to competitive CrossFit events, and now he's doing jiu-jitsu. So you could tell he's done a phenomenal job with rehabbing his shoulder, and since he did such a good job, this naturally led to his love of chiropractic, sports medicine, and getting people their lives back. I really enjoyed this episode with Dr. Schuyler, and I know you will too. Please welcome Dr. Skylar Pond. Today on the Expect Miracles podcast, we have a great guest, Dr. Skylar Pond out of Seattle, Washington. Dr. Pond is a sports rehabilitation chiropractor. He's doing some amazing work. He's also got a phenomenal team with him up in Seattle. And one thing I love most about him is he's got a phenomenal story on why he does what he does. So without further ado, please welcome Dr. Skylar Pond. Dr. Schuyler, how are you today?
I'm doing great, Dr. Pecca. This is fun. You have such a great energy to your intro. You're like my Bruce Buffer if I was in the octagon, man.
I'll just start following you around.
Yeah, I need a hype man. You're a member of my crew. Anytime you're looking for a side job, man, I'd love that.
So, Dr. Schuyler, where are you from originally?
I was born in Lahaina, Maui. Haven't been back there since the third grade, though. I'm looking forward to getting back there, actually. My oldest son's graduating high school this year. Strange year to graduate high school. But he's got his eyes on University of Hawaii Hilo. He's a soccer player. He'd like to get out there and play some ball. So we're planning on getting out to the islands here in December and checking it out, make sure it's a good place for him to pursue his education.
How did that shape you as a kid growing up out there? I mean, I've never been, but I hear it's just got some magical energy out there.
I mean, that's a good question. I mean, I like to think that there's some magic in my life, and maybe it has a big deal partially to do with that. I didn't grow up as much in Lahaina. My family had a little farm property in eastern Washington as well as in Maui, and we were kind of back and forth in my youth. I kind of identify as Washington being home for me. It's where I spent the vast majority of my life. But it was a very interesting upbringing. I had some wild, idealistic parents, and they gave me a wild birth name with a Hawaiian language name just for fun because whatever, they were being smart Alex. Gave me a name that meant Heavenly Full Moon Rising.
Really?
Yeah. So, I've got that background of parents that are vegetarians before that was acceptable as even healthy thing to do. They're like 40-year vegetarians. And I think in a way that definitely sets the platform of comfortable with being a little bit outside of the norm and kind of believing in what you see to be true and being willing to swim upstream and define your identity as what's healthy for you and your worldview and kind of working against that current. Because certainly we were. I mean, we moved to the Olympic Peninsula, basically a logging community, when I was 9 years old. And being a hippie, basically vegetarian family, that drew a lot of questions every single day. You had to be able to define yourself and define your decisions and defend your worldview. So I think that put a little upon me, my brothers, it put a little chip on our shoulder and made us able to kind of forge our own way. So it's interesting that you asked that. I hadn't really thought about it, but I would say that indirectly, yeah, that absolutely helps set the platform for creating the kind of life and the kind of community and the kind of clinic that we have.
Very cool. And I have another question for you too. You grew up playing a sport that isn't really mainstream or wasn't mainstream in the U.S. when you were growing up. Some of my best friends in college were rugby players, great guys, great community. It really establishes like they're very tight-knit, all the rugby guys. And
yeah.
Did you find that as a young kid or did you find that later in life?
Like most people, I came across in college, and I was just on campus and just saw a bunch of people running by in the mud. And I was like, are you kidding me? What the heck is that? I went to a very liberal arts school in Washington. I went to the Evergreen State College in my undergrad, mostly because they let me travel abroad my first year. So I was off in Ireland, off campus. So I got exposed to rugby there and came back. And it was just such a great community, as you say, like as kind of an alternative to a fraternity, but having that community bond. And it was so liberating for me. The thought of being able to run at full speed into another person without wearing pads and nobody gets hurt. It's incredible.
That's a good point.
Yeah. And that's what was enticing to me at first, just being a young man and wanting to see if I had the mettle for it, test myself a little bit. But then everything else about the culture and the community and the humility, the camaraderie really overwhelmed that. And I found so much more. And I stuck with that for, I suppose about 7 years before I stopped being competitive with rugby. I coach now, though. I've got a 17-year-old and 13-year-old boy who just want to play football and smash their heads into other people.
Yeah.
And I've just used rugby as a way to distract them. It's like, I know what you're saying. You want to be physical. You want to assert. You want to go out there and play. So a few years ago, I started a youth rugby program here in West Seattle with a couple other people at the West Seattle Wildcats. And, just took a mission to teach how to properly use your body mechanics, how to engage in full contact without using your head, and really setting the skill of being tackled and tackling, getting that into the biomechanics. So now at this point, my boy is a senior in high school, and he doesn't have access to do anything. He wants to be a collegiate soccer player, but that's all shut down.
Yeah.
They are playing high school football. So I let him go out for high school football, and he's just tearing it up. He's having a great time. He's having the most fun. And I think that baseline skill set of the rugby physicality really set him up for safe success.
And what's it like for an 18-year-old kid going out to Ireland for a year? I mean, college alone is pretty liberating. I can't imagine what it was like going out to Ireland for a year. That must have been awesome.
It was surreal, right? Just like taking the lid off the world and seeing what's out there.
Yeah.
I wasn't in the northern counties, but it was a northern part of Ireland in a fishing village called Glencolmkill with population of, under 200 people.
Wow.
When you land there, you learn the entire community.
Very cool.
You absolutely know everybody. They're coming over for tea. They're teaching you their traditions. You're engaging. You'd make a little effort to speak a little bit of their language. For an 18-year-old kid, that was really exciting. I couldn't help just kind of looking around this foreign world to me and thinking, I wonder what it would be like to raise American kids here. That might be kind of cool. I wonder what would happen. I gave it a shot. I started my first clinic in a little community called Douglas.
Really?
Yeah, in the south of Ireland, way down that southern tip where they kind of call it like the tropical part of Ireland because it's southern. So Douglas is even more southern. It's all the way down there on the southernmost point. Yeah, so the funny thing was, while they call it tropical, it definitely had the rain of the tropics. It rained for 74 days continuously when we were there.
Wow. Every day for 74 days.
And I believe it was 74 days of continuous precipitation. Not like it rained a little bit on 74 days. Like the entire village of Douglas flooded out just from rainfall, like shortly after we left there. We got flooded out. We were just like, well, we gave this a shot.
Unreal.
Yeah, but it was a different community. It was a lot of fun, kind of like explaining to people what the heck chiropractic is and having a kind of that first contact. It wasn't established there at all, and that was exciting about it.
It was like turning over a fresh leaf. They didn't really know much about chiropractic.
Yeah, it was. Their experience with me that's what chiropractic was.
Wow. Very cool, though.
Yeah, it was quite an experience. It made it so that getting there and starting up and getting the licenses transfers, piece of cake. The downside being anybody who feels like being a chiropractor that day could just hang up a shingle on their door and say, I'm a chiropractor. Like no organization, no governing board. It was the Wild West. It was super exciting. I coached my kids. Let's see. My boys were 5 and 1 at that point. And I was coaching their full contact rugby team for my 5-year-old. It was wild. It was super fun. Different culture, different community there. But it really made me appreciate and miss home. The Northwest is the place to be for me and my family. This is a heck of a country to live in. And I got to kind of check that box, scratch that itch. We were just there for a year and realized, okay, let's get back. Let's watch some Seahawks football in real time. Let's do this right.
Absolutely. Why did you decide to become a chiropractor? What is it that made you, was it something you always wanted to do, or is it something that kind of led you in that direction?
Yeah, I guess I had a couple distinct experiences with my own health and with practitioners that set me on that path. My first exposure to chiropractic was when I was 16. I was under the impression that everybody knew the rules of the road as written in the handbook when you're 16. When you enter an uncontrolled intersection, you yield to the right. You know what I mean? So I got into a lot of accidents when I was 16. Like I treated an uncontrolled intersection like going through a green light. You know, like I didn't even glance toward the left.
Yeah.
I would just drive through because it's like, you guys know the rules. It's kind of like going through a green light. I don't look both ways. It's like, you guys know what to do at a red light. We have an agreement here.
Yeah.
I just go through at 35 miles an hour, looking to the right through any intersection, yielding to the right, and assuming everybody else is going to do the same thing. And I got T-boned probably 3 times my first 14 months at driving before I kind of finally learned my lesson. and I had a fantastic chiropractor there in Port Angeles, where I went to high school, who was just generous with time, energy, skills, really took care of me in a way that I don't think my body would have recovered without this intervention. I think that it would have just changed the trajectory with which I would have healed. I wouldn't have had the opportunities that I've had to continue pursuing athletic endeavors well into my adulthood. You know, I'm 41 years old now, and I'm picked up a new sport recently, and I'm doing my best to see how far I can go with grappling and jiu-jitsu, and I don't think I'd have these opportunities if I wasn't put on the right course of healing back then when I was still in a developing body. So my mom tells the story still. She remembers this far better than I do, but I came back from that very first appointment with my chiropractor there in Port Angeles, and she asked how it went, and I said, I'm going to do that when I grow up.
Wow.
I said that as I walked past her, and she was just kind of floored because I've never really, apparently before that, had any interest in doing anything for money. You know, I was just going to go about and have adventures and be a kid. And that was always something that was in my mind somewhere, you know, like, well, not yet. I'm busy. I'm doing this rugby thing. And every rugby team I played for had a lot of talented chiropractors on those teams, because Life and Palmer are really great schools and have really great rugby programs, really great chiropractic programs. So I always had 1 or 2 really talented teammates on any team I was on. So it was just, for me, it was just normal to be laying on the grass before a game and for a friend to come over and just adjust my whole spine before I went out on the field. That was just kind of part of my experience as an athlete. And I realized that's kind of unusual for most people, but in my little world, that was just the way it was. It was something I had value in and appreciated. And then when I finally took the step toward it was when things became kind of urgent for me. Just like most healers, that I had a really profound injury that I had to overcome. And then that just changes you, changes your mind, changes kind of your purpose. And my situation was no different. I dislocated my shoulder pretty dramatically and destabilized the joint in a rugby practice, not even a contact situation. Just kind of came out in a cone drill and just hit the ground with my arm up overhead and thump and drop the shoulder out of socket, not the AC joint, the glenohumeral joint. And I was able to snap it back into place. And that was just my pattern, basically subluxating to dislocating in contact. Anytime a competitor was able to put a little step on me and I had to do an arm tackle, I was probably going to dislocate or subluxate. So I had to get great with my feet. I had to be able to get my full shoulder and head in there, and that was fine and safe. But anytime someone got around me, I was vulnerable, and I'd have to work the shoulder back in a socket, all that sort of a thing. And it just kept getting worse, and I was playing out on the East Coast for Old Blue. I was living in Manhattan at that point, taking a year off from undergrad, just having another adventure. It was a really good time. And I needed a solution. I had the jet surgeon consult, said I needed basically a whole shoulder, almost a shoulder replacement from the damage I had done to it. But the labrum and the rotator cuff were both torn in a couple different ways, a couple different places with a cyst in there. And it was just a disaster. But I was like, okay, what's the outcome going to be? And he's like, okay, it's going to be fine. You just have to stop playing rugby. I was like, well, for how long? He's like, just stop playing rugby.
Forever.
Right? 21 years old. And that was absolutely outrageous thing for him to say to me. And I said, okay, well, let me just give you some context. I'll stop playing rugby after the surgery if you never do surgery again. Then you can see what you're asking of me. Because that was it. That was my purpose. It's what I did. I was doing wildland firefighting in the summers. I was playing rugby, and I was just going to go as far as I could with these interesting endeavors of mine. So I dropped out of that pathway and engaged in some whatever I could find. I went back to the chiropractic route to get my alignment of my upper thoracics and shoulder girdle in place, kind of peripheral joints as well, the effective AC joint, the neck, everything was playing a role in that, trying to get into a good position to heal from, working with some creative physical therapists, and also experimenting a lot. Looking back on it, was kind of like CrossFit before CrossFit. I was doing a lot of like handstand push-ups and inversions and handstand walking and doing what I could to kind of challenge this joint in severe ways, because, you know, you can't just kind of pull on a piece of tubing and hope that then you can bring down a talented 245-pound Islander. the guy that are charging at you with skill and speed, that band work isn't going to do the job,
Right.
So it's where I really cultivated my vision of using strength as medicine to overcome injuries and trying to become accepting that my body's going to have its limitations. I don't have to heal every little bit about it, but I had to make my strength stronger than the weakness that was underlying, There's aggressive compensation patterns to make those vulnerabilities to my biomechanics irrelevant, to make that ligamentous end range I don't have anymore irrelevant, because I built up enough contractile tissue around it to protect that end range and keep me from even getting there. So yeah, at that point, I just got so excited about the success of my shoulder. Even though I was able to return to rugby pain-free and worry-free, the fire kind of went out on me a little bit in that I was way more excited about rehabbing shoulders all of a sudden. So looking around at my options and how to express that, chiropractic was an obvious one for me with my background and my experiences and really the freedom that you have as a portal of entry and being able to dictate my own treatment plans and protocols and not necessarily having things dictated to me by a surgeon that I'm associated with. So that's been the goal and the mission for the past 11 years in practice since graduating, has been to create the clinic that I wish I would have had access to back then when I was that person, and just putting together the team. So my wife, who I met on that wildfire crew that I alluded to briefly, we met on a crew and started a family ASAP. And she was in acupuncture school, so we started this clinic together. We've been co-treating with chiropractic, acupuncture, corrective exercise from day one. And then we put together the appropriate team of our sports massage therapists that are extremely talented, make our jobs much easier. Nurse practitioner that, again, has done tens of thousands of kind of joint reclamation projects. Like, my worldview has always been, let's make the most out of what you have. Right? We can kind of accept what your labrum is and what your joint is. We don't need to use that term of wear and tear. Like, we're not worried about that. Let's make the most out of what you have and keep you from just going down the pathway to having a joint replaced someday. When I bring this nurse practitioner with her regenerative medicine expertise on board, now we can also improve what it is that you have.
Right.
Using her skill set with creating a regenerative atmosphere inside of a knee or a shoulder or a hip and putting a halt to a degenerative atmosphere. So adding that to the team has been a real game changer. And I had a similar situation I had with my rugby injury. When it came to that, my first year of jiu-jitsu tournaments was my third tournament. I was competing in the open division, so I'm up against some wild 23-year-old in the finals. And we were just spazzing out because we're white belts, and that's just normal. You don't know what you're doing, so pure chaos. Anything can happen in there with white belt and white belt crime. Ended up in some kind of a scramble and tore my medial collateral ligament and my meniscus. Yeah, it just had a nice pop, like standing in shallow water and holding a big stone at your chest and dropping it, and it goes like kapunk, like a good release there. But I was in the middle of a fight, so I didn't stop. I finished it off and dealt with the consequences afterward, which was not wise. I shouldn't have done that. I was on crutches. I couldn't walk so well for a while, and then I took it as an opportunity to see what's out there. And have been hearing like on Joe Rogan from Mel Gibson's dad at that time, the experience I had with regenerative medicine. So I just went all in as an experiment to see what would happen with me. A series of PRP and amniotic fluid and even a stem cell allograft, tissue allograft injection. And I had this great situation being a team physician for that same MMA and Brazilian Jiu-Jitsu team, where I had two patients who, as luck would have it, had the exact same injury as mine. One just 3 days before I had mine, and the other competitor had her injury 3 months before I had mine. Same thing though. Medial collateral ligament, meniscus, left knee. So it was great. So I had this control group, right?
Very cool.
Yeah, because I'm running their rehab and they're both about 10 years younger than me. So we're all doing the same rehab. The only real difference is they were both female and I was doing the regenerative protocol in addition and they were not. And my healing response was, I overcame them quite a bit, right? I was back on the mat and competing when they're still trying to get the range of motion to do squatting still.
Wow.
That was an eye-opener for me. It's very rare to have that kind of a control group right there in your own life. So I really threw the switch on that. I got both of them in for just simple PRP injections to get them over the hump, and that did it for them. And I'm still working with them, but now it's on different injuries. Now we're on to hip and elbows and everything. It's always something.
Tore that medial meniscus?
Yes.
And so the regenerative medicine obviously isn't going to put that back on the joint, right? It's just going to strengthen everything around it. How does that work?
Yeah, with the meniscus, you have different vascular supply to it. Only on the outer third, you have much of a capacity to really heal that meniscus. In that medial 2/3, you're not going to be able to regenerate with the deficient blood supply there. What you really need out of the meniscus to make sure that the supporting structures, the articular cartilage on the top of that joint is articulating effectively with that meniscus. If you get a flap that lifts up, if you get a little like a bucket handle or a parrot beak or something like that, that's when you need a surgical procedure. So it's really important to work with that puzzle piece. Make sure that these gears are kind of lining up well together. So yes, treating the entire health of that joint surface is really important. So a major part of what you're doing when you're treating, say, a meniscus is you can think of the meniscus in the knee joint. I don't have to explain it to you, but I'll do this for your listeners. You can think of that as the floor in a room, like this little exam room that I'm in. That meniscus would be the floor of the room. And then we have that articular cartilage would be my ceiling panels in here on the top of the room. And then running through there, we have ACL and PCL. We have the medial and lateral collateral ligaments. When we treat my meniscus, and there's a protocol we use for others, rather than using our diagnostic ultrasound to go right into that meniscus on the floor of the room, we will treat the entire room and fill the entire room. It's like if we just filled this whole room with red paint. Yeah, the floor, my meniscus is going to be saturated in that paint. Mm-hmm. Yeah, with something like that, we're able to treat every vulnerable structure in there in a proactive way. I love the implication of ongoing durability for future ACL, PCL, MCL, LCL, articular cartilage degeneration, in addition to treating that meniscus itself. Yeah, so we also injected the medial collateral ligament directly multiple times. It's important that you treat all the supporting structures with something like this.
Right.
Yeah, when you lose stability in a moment like that, we can see through MRI or diagnostic ultrasound, whatever you like to use, you can see torn structures where you're overloaded. But we also know that you can't have so much hypermobility or end range of motion to tear some structures without affecting the integrity of your other structures. Everything has been compromised as far as its ability to hold that pre-injury integrity, kind of like, a severe ankle sprain, right? Even though if you don't tear the structures, you're going to have a lot of compromise to your neurologic communication in the area. You're going to have severe structure laxity issues. So you're going to have repetitive ankle rolls, right? So you have to think about the knee in a similar kind of a way. We like to treat infrapatellar, suprapatellar, all of the supporting structures. We're able to treat all of it when we go through a protocol for it. It doesn't take a significant, larger amount of time, no more expense for the patient. It only takes a couple more minutes to inject into the other relevant areas. So yeah, by treating the meniscus, we treat the meniscus and everything else in there. That's what got the result for me. And that's what we've had success with going forward.
So question for you, after the regenerative medicine, were you feeling like very good without even rehabbing yet? Or is that something you needed to incorporate too after the regenerative medicine took place?
Yeah, that's a great question. And I like that we're just using this broad term, regenerative medicine, because, if we said like stem cells, it's more of a pop term than actually a procedure that we'd use. But within that is in that whole world, any kind of a biologic, whether it's your own blood we're using as medicine or a tissue allograft or what have you, it all kind of fits into that world. But with regenerative medicine, like with so many other things, whether it's chiropractic or whether it's nutrition intervention, you're not going to have the same response out of every single person. There's so many factors. Some people are high dose responders and some are kind of low responders. And for me personally, I'm one of these high responders. When you take my blood and you spin it down to the platelets and growth factors and you re-inject that into one of my tissues, I have a off the charts tremendous response. And that's why I have a clinic like I have right now. If I didn't have that kind of response, I probably would have gone a different direction, But yeah, I was literally on crutches, still practicing. It was kind of funny. My clinic back then had 2 floors. And I'm going upstairs trying to carry my crutches under one hand and using the handrail and hopping around on one foot. I was kind of stuck like that, not really being able to weight bear very well for several weeks. The day after my first PRP injection, I came into the clinic without my crutches.
Wow.
Yeah, it was best case scenario. I was still limping. I was still vulnerable. I was still in pain, but I could weight bear. I had access to my locomotion again. So I didn't stop there, of course, though, right? I wanted to see what else could be done. And I had a very intensive rehab protocol involving consciously manipulating my nutrition, working with intermittent fasting to get my whole system kind of receptive and in a regenerative pathway. Because there's been great research done over the past few years that show that when you go through a fasting state, your body doesn't just break down proteins, like eat up your bicep and now that's gone. Just like with any kind of predatorial situation, that phagocytic activity is going to happen with your oldest, weakest, most vulnerable cells. Those are going to be ones that are eaten and used as protein for fuel. So yeah, using that knowledge and going through a nutrition protocol involving some intermittent fasting. And again, I like to be kind of aggressive with rehab with myself. Certainly, I'm always a lab rat. I'm always patient zero. So I was doing unilateral squatting with rear foot elevated. I progressed into that once I was able to do so without catching and pain-free. And that was eye-opening for me. Two things happened as a result of my knee rehab. We had one, I could see in a case study compared to my other younger patients who had the same injury, I was several months ahead of them and maybe permanently ahead of them in the functionality that I got at the end of the healing process. And what I mean by that is I had a couple objective kind of performance factors there. One, I'm a 41-year-old and I dunked a basketball within 3 months of that injury. And it's on my Instagram. My child videotaped it and he recorded it and he goes absolutely nuts afterward. Him and all the kids in the neighborhood have a little party. It's a pretty mediocre. It's a Caucasian middle-aged dunk. It's not like the most exclusive thing you've ever seen in your life. But the reaction from the children in my neighborhood is 10 out of 10.
Oh, yeah.
That meant a lot to me. That was only the second time I've ever done that in my life. And the first time was at my 10-year reunion when I was 28 years old in front of my old high school basketball coach on the whole basketball court. It was like take that kind of moment for me. But then, 13 years later, I got it for my second time. So that was an objective for me. Like I thought, well, if I'm investing all this time and money and this equipment and stem cell recovery would mean this to me. I have to have a stronger knee than it was before, and I want to be able to dunk a ball again. So the other element from the recovery process that was objective for me was that unilateral squatting. I did Bulgarian split squats with barbell in both a back rack and a front rack. And I was able to squat with my left leg, both heavier, deeper, and without any pain than my right leg within 5 months of the injury.
Wow.
Yeah. Like I realized, boy, my right knee is not so good. And that's not the one that I hurt. Like I just feels kind of like this is an old man knee. This knee feels 40 years old. Whereas the left knee just felt like had this kind of sparkly, kind of baby fresh feel to it. It was just ready to go. Just injecting fluid in there and separating the contact points was something that worked extremely well for me. And just being able to say like, okay, well, I can go 30 pounds heavier with my left knee than my right knee, and it feels better. Well, that was a wonderful objective experience for me. And that's not the same as a double-blind placebo-controlled trial, but that's as good as I'm going to get with my own personal experience.
Doc, I have a question for you. So if you could go back to your original shoulder injury and walk into your very own clinic, what would be the first steps on how you would take care of that injury?
Oh, lovely. Hey, no one's ever asked me that question before. I like that. Well, it's got to be a good blend of you've got to handle the basics really well, right? So I'd want to see a thorough assessment with an orthopedic assessment. I didn't get as much of that from my experience. I got imaging. It was like, okay, well, the image says this. So it wasn't as much about the functionality.
Right.
It was all about what's going on inside that joint and what needs to be done for that. That's an important part of the story, but it's only half of the story. So what we do and what I would have liked to seen then was first you start off with your basic orthos. We have to isolate which tissues are damaged, broken, and which ones are healthy. What's our strengths and weaknesses from an orthopedic standpoint? Of course, the shoulder is limited when it comes to that because one tissue is broken. None of them really function very well, and they all motions end up in pain. So I get that. But I would have liked to see to go one step further. And now let's see what the functionality is. In what planes of motion are we strong and stable? How much weight in an upright, bottoms up kettlebell should we be able to press? Because with my injury, if we recall, I was still playing rugby. I was injured, but I had high level of capacity. So I wouldn't have carried me with kit gloves. I would have liked to see someone put me in very challenging positions. Let's see how you do with destabilized pressing. Let's see how you do with inverted positions. The kinds of things that I was experimenting with on my own. I would have loved to had someone who with context, experience, and expertise running me through that and save me all the hassle of all the trial and error and bad ideas I came up with before I finally landed on some good ones. So a deep understanding of strengths, weaknesses, and functional goals and outcomes and what would it mean to have overcome the weaknesses would have been very useful. Like, okay, you're able to lateral raise at X weight. When you get to Y weight, okay, that's when you're clear to go on to this, and set up a clear guideline of kind of like a gauging of when I've opened up access to the next level of functionality and complexity of movement. That's the kind of the place that I went to. I wish they would have done that. And then when we bring it all together to the ideal that I have now, 20 years later, I'd like more of a holistic approach, getting understanding of my entire system's health. How is my diet, nutrition, sleep, rest, recovery? How's this all playing into creating a best case scenario? What I happened to be in a position just with my interests and lifestyle where I'm a high responder, right? But back then when I was 20, one, I wouldn't think I would have been nearly as effective. I was piecemealing together a garbage vegetarian diet at that time, living on carbs, like red vines and Snickers, and hey, that's vegetarian. Like if someone could have, put together more of a panel, we could have done a gut biome assessment, see how healthy my system is there, how much of my regenerative capacity is being wasted, kind of repairing a gut lining that I'm trashing, looking into different elements and weaknesses, what's going on with the epidermis, with the skin, what's can be manipulated there. That's when we kind of delegate to naturopathic medicine. I'm trying to get like a lifestyle foundation built up. Would have been great as if I would have had someone directing the cohesive use of the things I piecemealed together, having chiropractic and alignment dialed in, as well as soft tissue work and acupuncture. And definitely, I wish I would have had access to the regenerative medicine protocol back then. I don't think it was even an option back then.
Right.
But at a minimum, using my own platelets, that age, I love the effect that you get for a platelet-rich plasma injection series for a young athlete. Oftentimes, the more involved tissue allograft approach isn't even necessary. I like to back that up now. We use class 4 laser and cold laser, and we'll try to stimulate more out of that joint. At that time, there's been some promising studies when they take PRP, when you just spin down the blood and then you isolate the platelet-rich plasma, and they can laser it in isolation, and they just see the content of that tube change even outside of the body, and like, oh, wow, where all these growth factors come from. So we back up all of our procedures like that now. I don't laser the tubes. We only do that for me because I'm always a lab rat, right? But right after we inject a shoulder, then we'd go into the shoulder with a real deep penetration, like a 30-joule cold laser treatment to stimulate more of a growth factor there. So I'd love to see all of that for that shoulder injury early on. That's a big ask, but that's what motivates my staff and motivates me when we think about how can we improve our protocols going forward. We're always thinking about what would be that ideal situation for that acute injury, chronic injury. How can we manage this as best as possible?
Well, I love what you guys are doing, mainly for this reason, because I was in a very similar situation at you at 20 years old, but I didn't have a shoulder injury, I had a brain injury, I had a concussion from ice hockey. And I was going to see all these brilliant doctors, and it was like, when can I play ice hockey again? And they're like, no, you're never playing ice hockey again. And hearing that at that age I started breaking down and crying because that's what I was at that age. And to see medical professionals just shutting down your dream almost immediately, it's incredibly frustrating, and you get crushed personally. So it sounds like what you're doing is first of all, you're giving people hope. You've been there. People have hope in your story, and you're getting people better. And it's such a relief to hear somebody that's been through something and that patient knows it's possible to heal. And I think that's step one. And any person that walks into your office with an injury like that, it's very comforting to know that you've been there. We got you. We are going to do our very best to get you out of this, rather than, no, you're 20 years old, you're done. It's like, come on.
Yeah, well, I also have a little bit of a come to Jesus, okay, let's get serious here for a second. You're an MMA fighter. You're a rugby player. You have a recurrent shoulder injury. Okay, let's make sure this is clear. MMA is not good for your shoulder. You know this, right? Like, we're on the same page. We both understand that if your only priority is to have a lifelong healthy shoulder, you need a safer hobby. Are you clear about that? Yes, sir, I'm clear about that. That's why I'm here. Okay, so am I to understand that it's my job to help you navigate through this otherwise vulnerable and dangerous sport as well as possible? Yes, sir, that's what I'm here for. Okay, let's get to work. And then we dive in. Right? So it still is part of my job, is to educate and to make sure they understand their options. And the option that we're choosing is one where we know that this shoulder is going to be more vulnerable when we're tackling people for a living.
Right.
Right? And if that's your choice, then that's my job.
What if that same guy's like, listen, this is what I do doing MMA. What's your approach then?
All right. So this is a kid who says, hey, Dad, I'm jumping in the pool. I'm saying, I'm going to teach you how to swim. Right? So then it's my job to navigate that as safely as possible. We have to build up durability. We have to understand strengths, weaknesses, and build up. So it's like teaching them how to swim, right? I don't get into the specifics of their MMA style. I'm only a few years into that journey myself, and I'm not going to try to replace the advice of a coach. I'm not going to tell them when to tap or how to use technique, but they're going to have a good understanding as to what they can do to be as proactive as possible to protect themselves as much as possible. One of my very first MMA patients came to me on her way to be on The Ultimate Fighter, that Dana White series.
Yeah.
And I only had a few weeks to work with her, but her problem was that when she threw a jab, it was fine. When she threw any combination, she was fine. If she missed a jab and it came up short, her shoulder would literally dislocate. And her coach was keeping a book by ringside and putting that underneath her arm and popping the shoulder back into socket between rounds, right? It didn't happen every single time. And of course, I have to let her know, okay, this is dangerous. You're going to go in against people who are professionals and are great at causing permanent damage in brains and necks and spines. And going into this with a vulnerable shoulder puts you at a higher level of risk. You understand this, right? And she's like, I'd rather be dead than not compete in this sport. I'm doing this. Are you going to help me or not?
Yeah.
I'm going to help. So away we go. So worked with her for a few weeks, taped the hell out of that joint and got her into the camp. Faced an absolute axe murderer in that first round. Took a tremendous beating. Her shoulder stayed in the joint.
Nice.
So that was a bittersweet victory for Team Sports Medicine Northwest. But that's a decent example of what we do for people who are in that situation. We have people who are racing motorbikes as well. You want to talk about tremendous concussion risks, fractured pelvises, and torn about shoulders. I mean, wow. Yeah. It's an absolute demolition derby when someone slips off a racing bike.
30 feet in the air, just coming down, yeah.
Yeah, or even just sliding out from underneath you at, 170 miles an hour and going into a wall. Yeah, we've seen some pretty dramatic outcomes.
Yeah. So, Doc, at the end of every show, I like to ask all my guests, what is one piece of advice that has really resonated with you that you would like to gift the audience? Could be absolutely anything.
I would say that it's a lot easier to make your passion your work rather than get passionate about your work. If you have the opportunity to frame your life around what you love, then life gets a whole lot easier. So that's something that's been very useful for me. I'd say that I'm a lot better at receiving advice than getting advice. So my second piece of advice would be to receive advice.
Love that. Doc, where can people find you? Where are you located? Website, social media, all that stuff.
Yeah, so we're out here in West Seattle. The nature of the work that we do from a regenerative capacity, when we've done shows and platforms like this in the past, it's been great. We've worked with people abroad. I can zoom in and get the lifestyle dialed in for someone with their movement capacity and their nutrition and everything. And if they're doing something in like our regenerative capacity, dropping in for a day from all around the country, it works. And then off you go. You kind of have one day in clinic and the rest kind of remotely. So we have the capacity to access anyone from any place.
Very cool.
To be useful. The best way to reach out to me, I'll give you my direct contact. I've been doing this. It's been kind of exciting is to hand out your email and see what happens. But I'm happy to do so. I'm probably going to put a cap on this within the next month or so, but I'll get back and engage and maybe set up Zoom or what have you. If someone's interested in pursuing some of the lines of communication we've been on, you can hit me on my direct email. That's Schuyler, Skylar, at sportsmednw.com. That's my company name, Sports Medicine Northwest, abbreviated down to sportsmednw.com. And sportsmednw.com, that's the website. You can see all the biographies. I have a lot of video and rehab content in the video and blog section. The Instagram channel is Strength as Medicine. I'm not really aggressive with my Facebook and Instagram content updating, but you'll see some useful stuff up there, and I'll put links onto podcasts. And if you follow my personal Instagram, you'll get to see, my adorable cat's kids, and you can find that video of me dunking a ball a couple of years ago too. That's heavyweight spine straight, a ridiculous handle, but it rhymed, so I went with it.
Doc, thank you so much for coming on. You're doing some amazing work, helping out a lot of people, which it's all about. And thank you for laying out all the cards on the table, telling us about your story, and I really appreciate that.
Hey, I appreciate you. I appreciate your audience and the opportunity. Again, I love the energy you bring into this platform. It's a fun way to do it. This has been a good time. I appreciate it.
Yeah, and would love to have you on down the road again sometime soon.
Hey, that'd be great. Yeah, any topic you want. We can just chop it up. That'd be fun.
Beautiful. All right.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel
at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com. drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.